If I could get your attention for a few moments. First of all, on behalf of our Arkansas Center for Health Improvement staff, we want to express our appreciation for you turning out. It's been 2 years since we were together. It's been an incredible 19 months. First of all, congratulations for surviving a pandemic. Who would have thought we would know how to Zoom or do team meetings or work remotely or all of the things that we've learned in the last 21 months. But I do want to start off and actually ask for a moment of silence because we have folks that have not made it through the pandemic over the last 2 years. You know, friends, family, colleagues, individuals around the world that we'll never know. So if I could ask just for a few moments of silence, I'd appreciate it. Thank you. You know, your Center for Health Improvement, we're going to be entering our 24th year. And it's hard to believe that we've been around 24 years through original efforts of the Tobacco Settlement Act, through the Governor's Healthcare Roundtable trying to solve health insurance in the early 1980s, child obesity effort that continues today, the trauma system that we doubled the tobacco tax to actually put in place statewide for all of our hospitals that we have now, the stroke system building off of, and the heart attack efforts going forward. The rural health efforts that Melly and others continue to advance that we haven't yet solved our rural health access issues. Clean indoor air, where we did that before the U.S. Surgeon General came out calling for indoor airspace to be smoke-free. We've lost some along the way. We still don't have vaping as a restriction on clean indoor air. So you can't smoke here, but you can vape here after we're gone tonight. But it's been a great run, and I have a great team that has helped set this up. I hope you get to meet many of those folks tonight. I think we've been true to our mission to be a catalyst for positive change in our health and our healthcare system. I'm a chemistry major as an undergraduate, so catalyst is something that tries to help make something happen, but doesn't provide all of the raw materials and isn't around when the real thing gets done. And so it's because of the individuals and the organizations represented here, and we're Zooming this out across the state. Others that were not able to be here or that wanted to participate via Zoom are there. I'm hearing something. Are y'all hearing? It's my phone. That's embarrassing. We still haven't got all this technology after 21 months. I was like, wondering why y'all weren't hearing it. I was hearing it up here coming from my pocket. You know, we continue to show progress. We've got new programs, new innovations. Many of you are leading on initiatives to try to help Arkansans in need across the state. And our center's nimbleness helped us fill some gaps as the pandemic hit and our institutions were not able to fully respond. We built lots of new friendships building off of old. Our efforts with the municipal league and mayors and town council members across the state, our school district information that the health department helped enable us to create, help superintendents and school boards start coming to ACHI for information. I will be honest and say I'm okay if I don't go to another school board meeting for a while because those were not necessarily the most enjoyable. I think the pandemic also exposed lots of gaps and lots of causes for inequity. I think your team, the data architects that we have, the analysts that we have, the policy experts that we have at ACHI are committed to keep the light on those disparities and to help with you look for opportunities to close those gaps and to actually make it where good health is not an option, but it's the expectation for Arkansans across the state. In a moment, I want to ask Rick Smith and Joe Bates to come up. I have an incredible health policy board. If our board would stand up on the health policy board here, we've got good turnout tonight. This is a group of very diverse individuals. I've got very conservative folks. I've got progressive folks. We represent the state in lots of different venues. They lend us their name on occasion. And most importantly, when we have an idea that we say, where is this going to go wrong? And I put it out, they tell me pretty quickly where we're going to get off track or where we're going to have resistance. Last year, virtually, we gave Kathy Grisham, the CEO of Community Clinic in Northwest Arkansas, and Dr. Jim Zinni, long-term physician in Mountain View, the Tom Bruce Award. We did that in absentia. Glad to be here this year together. Want to recognize and acknowledge Dr. Stephanie Gardner, the Senior Vice Chancellor for Academic Affairs and Provost. She has been on our policy board twice. She is stepping down now, and she may be back the third time. There's no lifetime limit on service years for ACHI. The pay is so good, everybody always wants to come back. And I clearly want to recognize the core support of our sponsoring organizations, Dr. Patterson of UAMS, Marcy Doder of Children's, Dr. Romero at the Health Department, represented by Renee, and Curtis Barnett at Blue Cross Blue Shield, represented by Alicia here tonight. Without those organizations providing us some core support, some unrestricted funds, we would not be able to be as nimble as we've been over the last 2 years in response during the pandemic. But finally, let me just thank each and every one of you. We made it through a lifetime experience. I think, if we're honest with ourselves, we all have been stressed in different ways. We all probably represent and experience grief in some situations, anxiety in other situations, and not been an aspect of our lives that hadn't been fully impacted. So I think going forward, a little bit of grace from each of us. And as I've said on our municipal league call, it's really important just to reach out to a family member, a community member, a faith-based member, and say, how are you doing? Sometimes just that little question can open the door up for somebody who really has been through a lot through this pandemic. Let me ask Joe Bates and Rick Smith to come up. We've got an exciting new announcement that we want to unveil tonight. I'm honored and proud on behalf of ACHI to announce the G. Richard Smith ACHI Fellowship in Health Services Research. Rick was a founding member, actually founding director for our center. This one-year fellowship will provide support for individuals who are interested in pursuing an advanced academic degree or in early stages of career development in a field that's aligned with the mission of our center, to be a catalyst to improve the health and healthcare of Arkansans. We'll begin this award next year. It'll be a competitive award. So we will send out an application process and would ask for each of you to think about individuals. From 2000 to 2013, Rick was the chair of the psychiatry department at UAMS. He then served as dean from the College of Medicine, returned as chair, and retired last spring. ACHI would not be here without Rick. And I would like to ask Joe Bates, who was here at ACHI's founding, to share a little bit about the vision and the contribution Rick made getting us started. Joe?
Good evening, everyone. This is a very abbreviated story. Back in the late 1990s, my good friend Bob Schultz, who's now passed away, and I would talk a lot. He was a very accomplished person. He was on the University of Arkansas Board of Trustees. He was on the Winthrop Rockefeller Foundation Board. And we'd talk about, why is Arkansas such an unhealthy state? And he'd just pound that onto me. And so we just talked about it. And then finally, he said, why don't we ask for a grant from the Winthrop Rockefeller Foundation to develop a proposal, a thoughtful proposal about how to get Arkansas out of its bottom. And well, I said, well, okay, we could do that, but I need a bright young man that has ability to think thoughts that are creative to do this. I looked around and found one, Rick Smith. Young man. He was young. And so he and I and Bob Schultz talked, and we said, well, we better go to the Chancellor at UAMS, Harry Warden, tell him about all this, what we want to do. He didn't like it at all. I mean, kindly would be to say he threw us out of the room. And so, well, the health department has a lot to do with policy and health. And so we go over there and we get the same cold reception. We don't need anybody else worried about all this. We've taken care of it. And but we didn't give up so easily. We wrote, and Rick was the creator of this. a grant proposal to the Rockefeller Foundation. And we got about, I think, $400,000. No, I think we got much less, 50,000 the first time. And we wrote this grant, and it was to convene a lot of people from all around the country, I think 10, to come and spend a few days and give us some advice. And we did that. And then that allowed us to put together a more substantial grant. And I think it was $500,000 to the big Rockefeller Foundation. And thanks to Rick, more than anyone else, we got that funded. And so this was going to start a new entity, the Arkansas Center for Health Improvement. And it was born. And who was the first director of it? Rick Smith. And he was already recognized by this time a very creative person in the whole UMS family. And he took on this as doing that as well as all the other duties he had. And after a while, I think a year or two, 3, he found another bright young man who brought him in to really run ACHI after that, and all the wonderful things that ACHI has done now for 24 years. And these two guys are the leaders of all that. And we should be very, very indebted to them.
You want to say anything? All right.
Well, I'm certainly indebted to the two Joes. Joe, whether he likes it or not, gets credit as my mentor from the time I was a junior medical student until I retired in June. So Joe's been my long-term mentor, and I've learned so much from Joe Thompson, and I'm so grateful for what ACHI's been able to do and what you've done with it, and what an impressive organization it is, unlike any that I know of in the nation. And then I'm also grateful for this honor to have a fellowship that can start young people on the path to being successful in this area. So thank you all, and I'm grateful for this wonderful honor. Thank you.
Let me ask Justice Tuck to come join. The next is an exciting and important part of our annual event. It's the award of our policy board's Dr. Tom Bruce Arkansas Health Impact Award. Many of you know Dr. Bruce. His career was spent promoting access to quality health care for underserved and rural populations. Dr. Bruce was originally a medical school dean and then left and went to the Kellogg Foundation, where he came to better understand the needs and opportunities for rural health. He, along with his wife Dolores, offered a challenge grant to help form ACHI of $100,000 when we were first started. And their contributions to UMS and other issues across the state have demonstrated a strong commitment to rural health. About 7 years ago, our policy board formed the Tom Bruce Arkansas Health Impact Award. It's given annually to an individual that's demonstrated courageous leadership and a staying record as a catalyst for improving the health of all Arkansans, who exemplifies our 4 core values at ACHI of trust, commitment, innovation, and initiative. And so let me turn it over to the chair of our Health Policy Board for their decision and this year's awardee. Justice Tuck.
Thank you. Thank you, Dr. Thompson. I appreciate that. And I have been visiting with Dr. Williams before this presentation and telling him, as a trial judge, I had many times when I was dealing with situations where people had mental health issues back a long time ago, who had no access to any care in North Arkansas, across North Arkansas. And unfortunately, that still remains the case in parts of Arkansas. I'm pleased to know that we now have virtual ways for therapists to visit with patients. It's really difficult to overstate Dr. Williams and how he has had an impact on behavioral health in Arkansas. In 2008, he retired as president and CEO of the Ozark Guidance Center in Northwest Arkansas, an organization he successfully guided for 30 years. Originally, it was modest-sized, serving only 4 counties. Today, Ozark Guidance is part of ERISA Health, which serves more than 60,000 clients a year in more than 40 counties. Always on the forefront of innovation in the industry, Dr. Williams implemented an electronic health record as early as the mid-90s, worked to bring telehealth solutions to rural parts of Arkansas, and was an early adopter of the concept of integrated care and wellness. As a personal point of privilege, I'd like to say, Dr. Williams, I was a walker with a friend of mine who worked at a local health provider, remain nameless, and the doctors were fighting electronic health records. So I'm pleased to know that you were the innovator. After he retired, Dr. Williams worked for UAMS Psychiatric Research Institute's Northwest Arkansas Clinic, where he helped establish inpatient psychiatric services to a region that had long been without local acute care for adults and serious mental illness. Undoubtedly, the behavioral health landscape in our state, especially in Northwest Arkansas, would look enormously different without his immeasurable influence. Please, if you will now, direct your attention to the screen for a short video.
I would describe David Williams as dedicated, articulate, tenacious, and unassuming.
He is full of humility. He is genuine, and he is visionary.
I would describe David as kind, compassionate, trusting.
Well, I'm David Williams, proud husband of Patty and the proud father of 3 great children and grandchildren. And life is good. Well, I was raised in a small town in southeast Texas, just south of Houston, called Alvin, Texas.
We met in Austin, Texas, and we actually did a workshop together. And at that time, David was married. And then, lo and behold, he was not married. And so we were in Austin, Texas together before we came to Fayetteville.
Went to college at TCU, which was my church-related school, and went to seminary at the seminary there.
I don't know that everybody knows that he once was a minister.
Came to realize, frankly, I don't think I was very good at at being a minister, but I was really okay about being a counselor.
He then chose mental health as a place to express his love and compassion and wish to contribute to the betterment of the world.
I traded a parish or church-based ministry for a community-based ministry, and essentially have seen my work in mental health as an extension of that pastoral care.
Dr. Williams was instrumental in establishing the continuum of care for mental health services at a time when mental health had great stigma and the resources were not available statewide to achieve what has happened during his tenure.
David, by his example and his leadership at Ozark Guidance, literally did transform behavioral health care in Arkansas. He built an organization that was first rate,
one thing that David is really good at is assembling a team that works together.
I came to work at Ozark Guidance Center as an intern, and he was the CEO at the time.
I met David Williams in 1985. I was an undergraduate social work student, and even though he was the executive director, he made a point of getting to know everybody that came into the organization, even interns like me.
David was just the kind of person who took everyone under his wing and really invested in us. And he taught us about the mission and its importance. He could always see so far down the road, and then he always brought all of us along with him. And he was all about being a servant leader.
It wasn't just a job to him. It wasn't just a career. It was a passion.
He was relentless in his efforts to ensure that people who sometimes are invisible to others did not go without care.
Being consistent with that dream that we would make community mental health services accessible, of great quality, and affordable. And been pretty faithful to the dream here. And I credit the board and the staffs over the years for that.
I can, off the top of my head, name 3 other CEOs at other community mental health centers in this state who were mentored by David. That's a remarkable legacy.
Everybody knows that he has impeccable manners. He was taught well by his mother.
He was able to shape relationships. He built trust and credibility with policymakers, legislators, government officials. They knew that when David spoke, that it was founded in research, that it was well developed, and they could trust his opinion and his thought.
He ran by far the best community mental health center in the state, and perhaps even the best community mental health center in the region.
It's been my life's joy as a career. It took me a long time to realize that that was a form of ministry. It really gave me an opportunity to develop resources and systems that'll be lasting. And that was what I would hope, that we would build systems of care and build an appreciation for mental health as a vital force in total well-being. So I'm both thrilled and very humbled and extremely grateful.
Dr. Williams epitomizes Dr. Tom Bruce's commitment to have high-quality, accessible care across our entire state, particularly in rural areas that are frequently underserved.
He inspired me, and he's one of the reasons that I do what I do and did what I did.
He's full of compassion. And that's what he's passed on to our kids.
Dr. Williams, on behalf of the Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being the 2021 Dr. Tom Bruce Arkansas Health Impact Awardee.
His award, I want to give credit to the nominator, Dr. Laura Tyler. Thank you for nominating Dr. Williams.
Thank you.
We are also presenting you and your wife, Patty, with a one-of-a-kind decorative bowl from James Hayes Art Gallery in Pine Bluff.
Oh, thank you.
Congratulations.
Thank you very much. Yeah, I set it down here. Justice Tuck, thank you so much. And thank you, Rick. It's a great time. This is one of the times when you know it's best if you quit while you're ahead. Those wonderful comments in that wonderful video, I'm
I'm deeply touched. They said I could have a couple of minutes to say thank you. I'm gladly to accept the Impact Award for this year on behalf of all the people at Ozark Guidance Center that work so tirelessly, so caringly, so competently on bringing a range of mental health services, behavioral health services to Northwest Arkansas. I am so grateful that that has happened in the time that I got to work there and continues to happen under Dr. Tyler's and other leadership. I want to tell you that I'm so grateful for ACHI's affirmation of our work. And I'm so humbled that you see it as consistent with Dr. Bruce's values historically, and that it's consistent with the values and priorities of ACHI currently. To know we're part of that mainstream and to be recognized for that is food for the soul in the work that I am part of. So I thank you for that. I also want you to know that I've been moved and so thankful for this evening, for the video, for the plaque, for the occasion, for the caring comments, for the touch base with so many of you who have expressed and support and concern and love. I am a rich man, not by monetary standards, but by the standards of the people that I have had the privilege of working with, from the staff of Ozark Guidance and Board to the people here at ACHI and lots of people and organizations in between, because this is one of those places where you got to be family to succeed. And we do have a family of people who care about behavioral health throughout this state. And I got to be one of the fortunate quarterbacks in one play in Northwest Arkansas for a few years. And I'm grateful for that. And I'm grateful for this award and recognition. And I thank you.
Thank you, Dr. Williams. Our one last piece of exciting news, in conjunction with the Tom Bruce Award, a donor family has earmarked funds to advance Arkansans' mental and emotional health in the name of David Williams. So this will continue to move forward and extend the Tom Bruce Award in additional ways. So let me congratulate you again and thank you. Let me close. ACHI would not be successful if it weren't for every one of you individually and the organizations that you represent. We've got a lot of work to do. I think the pandemic has exposed a lot of shortfalls that we had before, some of which we knew, some of which we did not. I would encourage you to ask that simple question of your neighbor, of your friends, of your family. It's been a rough year. How are you doing? I think it's a simple question. And it's an incredibly important opportunity for somebody to recognize, you know, it has been a rough year. So let's celebrate this evening. Thank you for being here. For those that are here telephonically or videography or Zoom-wise, whatever the right thing is, thank you for joining us also. And let's stay safe and let's continue to make the progress that we are against this threat. Thank you very much.